Yeah. Hi, students. This is Dr. Badrinath. Okay, we are studying about the pharmacology. Anabolic steroids is today's topic. Anabolic steroids, right? Anabolic steroids, also sometimes called as a performance enhancement drugs. Performance enhancement drugs. Mainly, some of the athletes they are using these anabolic steroids because keep in your mind anabolic hormones, anabolic steroids, anabolic drugs increases the buildup of the muscles, bones and muscles will be strengthened by the anabolic steroids. That's why athletes are misusing it. Should not supposed to be misused. So don't play, don't run, don't do athletes with the steroids. Russia is the one of the country having a number of players they are misusing the steroids, doping. That is called as a doping, drug doping and all. They are using the gold medal. What even though they win the gold medal, they will withdraw. That's why, okay, don't play with steroids. This is the syllabus. We have completed as per the your university pharmacology of drugs acting on endocrine system. Here I have already completed androgens, gen, gen. I have already told difference. Sexual organs, generation, generator. Okay, anabolic steroids. So that is a anabolic steroid is our uh, the topic today. Okay, anabolic steroids, right? See, anabolic steroid, first of all, you have to know the difference between the anabolic steroids and androgenic things. Anabolic, what is the meaning of anabolic? What is the meaning of androgenic? In the last video, we have completed androgen steroids. In this video, we will see the anabolic things. Okay, anabolic steroids. See, androgenic means here, this point you have to underline. Most of the students, they are confusing here. Genic. Genic means generation. So sexual organ. These steroids action on sexual organ development is called as a androgenic gen. Whereas a anabolic, here you can see the B is the point here. What you have to remember. Steroids action on a bone. See here. A bone. Like that you can remember. A, B. Both are important. A and B. A bone. Bone and muscles. See here. Bones and muscles will be strengthened with the anabolic steroids. Okay. This property is called as a anabolic property by the bones and muscles. That's why those players they are using anabolic steroids, not androgenic steroids. Androgenic steroids only to improve the sexual organs performance, whereas a bone and muscles performance will be increased by the anabolic effect, anabolic action. So that's why today's topic is anabolic. Keep in your mind players wherever anabolic comes. A bone. And there is one more term also where the students are confusing catabolism. Catabolism, here you can see anabolism, we know this is a building of a muscles, biosynthetic metabolism. See all the nutrients, whatever you are taking external nutrients, see here, see my cursor, external nutrients will be converted as a intracellular precursor, converted to intermediate, and it will get a polymers in the body. Since that it is a constructive action, anabolism. So body, bones and muscles will be constructed, anabolism. Whereas a catabolism is the opposite. It is a energy yielding metabolism. Energy will be liberated. Energy will be created. Okay. So here the products will be break down into metabolites. So energy will be liberated. See, this is catabolism, energy yielding metabolism. Energy sources will be breakdown. See, ATP will be breakdown into ADP and it releases the thing. Okay, metabolic product. So how to remember this catabolism? CA, calories. You have to remember calories, energy yielding metabolism. This is the biosynthetic metabolism. Like that you can remember. Anabolic steroids, Mainly it acts on the muscles and bones. Even though a small having an action of androgenic also. Androgenic action also. Small quantity. Okay. See, these are that's why in the, whenever you are doing experiment, they will do the ratio. Ratio is important. I will explain you what is this ratio. Anabolic steroids, these are the synthetic, which are man-made steroid androgens. Okay, higher anabolic and lower androgenic activity. This is very very important. Higher anabolic. See here. See the where whenever I will show the muscle and bone, this is anabolic property. Wherever I will show the prostate gland. See here, I shown the prostate gland belongs to sexual organ, that is a spermatozoa like that. Okay, here you can keep in your mind. This is the androgenic. So anabolic by androgenic ratio they will calculate. How much it is having a anabolic effect? The steroid. How much it is having a androgenic action? It is divided, it is given in the as a ratio. Here you can see. Anabolic steroids having a higher anabolic. That's why players are using. Okay, that is a point what you have to keep in your mind. And lower androgenic activity. Okay, the anabolic androgenic ratio, activity ratio is determined by the, for any drug you can determine the what is, how much it is showing androgenic action, how much it is showing anabolic action. That can be determined by injecting into the rats. See, they have developed a steroid. That steroid, first of all, they have to know what is androgenic action, what is anabolic action, which is more, which is dominating like that. First, what they will do, they will give an injection to the rats. The dose what they have prepared, what they are suspecting that it is having a steroidal action, then that injection they will give into the rats. Then castrated rats, castrated means rats along with testis, because androgenic action they have to know. Then what happened? They will measure the increase in the weight of the muscles to that of the prostate gland. See, this steroid increases the weight of muscles and bone. Then what you can say? It is an anabolic property. Okay, when it increases the weight of the prostate gland, then you can say it is an androgenic activity. That ratio, see, the anabolic and androgenic ratio of testosterone is always considered as a one. See, that's why I have written first one is anabolic. That's why I kept muscle and here divided by androgenic ratio. This is androgenic. This is anabolic. Okay, testosterone they will take it as a standard default. It is a 1 1 1 standard. It is a, so they are always comparing all the steroids whatever they have prepared, anabolic steroids or whatever it may be, any steroid. If they want to check anabolic with the androgenic ratio, they will take a standard as a testosterone. Testosterone ratio is one. Number of times it was appeared in the question paper. What is anabolic androgenic ratio of a testosterone? It is a 1. Okay, and methyl androsterone, see here, oxymethalone, oxandrolone, nandrolone, propionate, stanozolol. See, these are having a, here one point you have to keep in your mind. If this anabolic androgenic ratio is increased more than 1, then you can say it is having a dominant anabolic activity. Because why you will get these higher values? Because if there is a high value of this, automatically you will get a higher values. Okay, the numerator value is high, that is the anabolic effect, then automatically anabolic androgenic ratio will be high. See here, stanozolol, 30. 30 means it is 30 times having a greater anabolic effect than the androgens. Like that. Okay. You see, these are all the anabolic steroids. Synthetic and these are the synthetic androgens which is prepared in the laboratory only. In our body, there is no such type of production. Having a higher anabolic activity, lower androgenic activity. Example drugs, nandrolone. Here we saw no nandrolone. See here, nandrolone 10. It is having a 10 times shows the greater anabolic action than the androgenic action. Okay. Oxymethalone, stanozolol is a stunning, okay, because 30 times greater than the 30 times having a greater anabolic action than the androgenic action. And methandione. See, this all these you have to keep in your brain and take a screenshots, and you have to see here synthetic androgen. First one, nandrolone. Here I have shown, so that you can keep easily. These drugs are misusing by the especially stanozolol. Stunning performance will be there if you are using a stanozolol. You cannot guess your performance also. 30 times more you will run more. Okay, more performance will be boosted like anything. Nandrolone. See, okay, oxymethalone. See here, oxymethalone. It is available by the Magnus Pharmaceutical. 50 tablets. Here you can see the cursor. This is tablets available. This is the injection form. Nandrolone is available. Okay. So nandrolone, oxymethalone completed. Stanozolol. This is the 30 times greater I have shown. No? Okay, stanozolol, stunning performance. It will be like this, like a lion. You will become a lion. And here you can see 10 ml, multiple dose vial. It is a injection only. And the last one, dinone. Methane dinone. None you can keep in your mind. 10. These are the available as a tablets. Okay, this is injection. And anabolic steroid uses, where we are using these anabolic steroids. First one, see, catabolic states, acute illness, you will become a very less energy. In such a cases, you can give it. For example, say trauma, severe trauma condition, major surgery. After surgery, what happened? There is a loss of a muscle, loss of a bones. In such a cases, if you give these anabolic steroids, then it will be build up. Muscles will be build up. See, most of the muscle will be cut down in the operations and during the surgery. If it has to develop again, regain again, in such a cases, you have to give a anabolic steroids. Major surgery, renal insufficiency. When the kidneys are working insufficiently, in such a cases, you can give a these type of anabolic steroids. Okay, acute illness, severe trauma, major surgery, okay, renal insufficiency, osteoporosis. Your bones will become a very less dense. Density of the bones will become a less. Pores will be formed. Osteoporosis. Osteo means bone. Porosis means pores. Because calcium will be taken by the blood, so that your bone will become very weak. In such a cases, if you want to strengthen the bone, then you can give this anabolic steroids. Okay, suboptimal growth in boys. See, this person, this boy's growth is suboptimal, below than the normal. This is a normal height. Actually, he has to grow, but here this is suboptimal. It is a less. 2 inches is less. If he want to grow, then we can give a such type of anabolic steroids, because muscles will be grown, bones will be grown, everything. Okay, and anemia, blood performance, because bones are the main responsible for the synthesis of the blood. You know very well, bone marrow, red bone marrow is mainly responsible for the synthesis of. If bones is not there, how the blood will come? Isn't it? That's why anemia, in case of anemia, bones will become a weak. Bones are unable to create a RBC. In such a cases, in such a anemias and all, aplastic anemia especially, very important word, aplastic anemia. You will get a plastic bones. It looks like a plastic bones. It doesn't perform. That's why I'm telling as a aplastic bone. Aplastic anemia. Blood will not be created in such a type of bones. Look like a plastic. It is bone is there in the body, but just like a plastic bone, it was unable to produce the blood RBC. So anemia, in such a cases of anemia, malignancy, and performance enhancement. This is a misusing of the some athletes. Not shown what shown here. No, some athletes they are using just for still only. I have kept this image. Okay, and this is androgenic effect. This anabolic is completed in androgenic, that is sexual characteristics development, organ development. Drugs using for erectile dysfunction, that is a penis unable to sex, unable to do pregnant. In such a cases, erectile is not functioning. Okay, that is penis is not functioning. In such a case, these are the very popular drug, that is Viagra. Viagra is which increases the men's power. Sildenafil, Tadalafil. This Viagra consists of a sildenafil only, but don't nobody knows. Oh, everybody knows Viagra, 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 but nobody knows. Most of them are knows that they don't know that sildenafil. Seal, then fill, like that. You take a bottle, first seal it, like that you can remember easily. Seal it, then you fill it. Seal, then you fill, like that you can remember. Sildenafil. Okay, Tadalafil. These are the two drugs mainly used. Here you can see here Tadalafil tablets. Okay, and this is Viagra, 100 mg film coated tablets. Sildenafil tablets are there. You can see here. And mechanism of action, how this sildenafil and tadalafil will act. A very uh, interesting one. See here, first of all, you have to see this nitric acid. What is the main job of nitric acid? This nitric oxide converts the GTP into GMP. Nitric oxide, NO, no. Nitric oxide converts the GTP into GMP. What is the GTP? Here I have mentioned. What is GDP, GMP, cyclic GMP? All I mentioned here. Okay. So GTP is converted into CGMP. This is very essential for the erectile function. Okay. So this CGMP mainly responsible for the erectile function, proper function. Okay. Protein kinase G decreases the cytosolic calcium, smooth muscles will be relaxed. Then he is unable to do, that is a function, erectile proper function will be there. This leads to vasodilation. Blood supply to the penis will be increased. If there is a CGMP, that is natural process what is going on. Okay. And whereas this is one of the enzyme PDE5, here I have mentioned phosphodiesterase type 5 enzyme. This is one of the enzyme. What did this do? This enzyme will break down the CGMP. It converts the CGMP into GMP. So we have to stop this. When you stop this enzyme with the help of sildenafil, tadalafil, these tadalafil, sildenafil avoids, it kills the enzyme of PDE5. This enzyme will convert the CGMP. Actually, this should not supposed to be occur. So this PDE5 inhibitors Tadalafil, sildenafil. Okay. So when it inhibits, CGMP will be there like that. So CGMP happily it supplies the blood to the smooth muscle relaxation, vasodilation, proper erectile function will be there. Okay. See here, this matter I have wrote CGMP relaxes the smooth muscle. See here, smooth muscle relaxation and increases the blood flow to the corpus, okay, cavernosum. This results in erectile function, right? Sildenafil, tadalafil enhances the effect of NO. Nitric oxide effect will be increased by the sildenafil because it is stopping the here cyclic GMP formation. So that cyclic GMP will be there. So it enhances, it boosts up the nitric oxide function. Viagra is a selective phosphodiesterase PDE5 inhibitor. That is very, very important. Number of times it was appeared in the examination, competitive examination especially. Okay. Sildenafil is available as a more commonly known as a Viagra, sildenafil. Vardenafil is a Cialis and Tadalafil, it is available as a Levitra. Okay. Like that you can see the thing. Okay. Right. So main thing what you have to do, PDE, phosphodiesterase 5, that inhibited by that. Okay. So thank you. You can watch my playlist. I have kept all the videos.